So continuing on the benefits of PGS, besides knowing what you have frozen, sex selection, and improve implantation rates, then you're also going to have a lower chance of miscarriage. As you get older, the miscarriage chance increases. In your mid-30s, starts increasing significantly. In your 40s, increases very rapidly. So if you transfer a normal embryo, depending on what you look in the literature, the chance of miscarriage is about 7 to 10%. The best case scenario for patients in their 20s that just get pregnant anyway is about 10%. So these patients in their 20s will probably stay the same, perhaps decrease the chance of miscarriage a bit. But for all their patients, they're probably going to be successfully decreasing the chances of miscarriage. But then the risk doesn't end there. As the pregnancy continues, you're going to be offered around 11, 12, 15 weeks, 18 weeks testing that will help you determine if the babies have morphological or physical characteristics, or if there's markers in your bloodstream or elsewhere that increases the chances that you have a baby that has abnormal chromosomes like Down syndrome or so forth. So if you've tested your embryos and you've transferred a normal embryo, or what is considered to be a normal embryo, that chance of you having to go through invasive testing is going to be smaller. You should still get tested. You should still test your blood and do your sonograms. But the chances that you're going to get an abnormal reading, or significant abnormal reading, are probably going to be lower than if you had not tested your embryos. And if you get an abnormal, they can compound that abnormality with the PGS results and see if invasive testing like CVS or PGS would be necessary, or at least better counsel you. And so I think the benefits of PGS are tremendous. I think after you invested so much effort, time, and money into these complicated cycles, it's just an additional thing that you can do to give you peace of mind, to reduce future anxiety. And we do find that most of our patients are choosing to do them. Obviously, the older they are, the more they're doing it. It also should lower the number of embryo transfers, failed embryo transfers that you're doing. So there's a financial benefit. A failed transfer costs as much as that PGS. So one prevented failure is probably going to pay for the PGS. And we all know that it's not just money, it's putting a woman through all the appointments, the blood draws, the injections, the medications, the cost of all that stuff, that takes a heavy call. So if you could prevent that, then I think we've accomplished a lot. So again, it's just an option. It's not for everyone, but I think you should be at least counseled about it and consider it and see if it's something that it's worth you. Now, the risks of PGS, obviously, not anything is 100%. Just because the embryo is called normal, it's not a 100% chance that it's normal. There's the risk of harming the embryo. In our lab, we get a 98% or above survival rate for embryos that we thaw after we've tested for tested to do PGS. So that's excellent. So it's not a huge reason not to test an embryo. Could in the future we find something that testing the embryos causes downstream? Perhaps, but we don't know that now. So again, consider your options, get educated, and make smart decisions. Take care.